Hi, welcome to Living Well with Cancer, brought to you by the Cancer Resource Center of the Finger Lakes and the Cuba Cancer Center right here in Ithaca, New York. Tonight's presenter is Kimmy Jones, and she is with Hospicare presenting Advanced Care Planning. So, Kimmy, I hand it to you.
Like I mentioned before, Hospicare is the agency that provides hospice services in Tompkins County and Cortland County. Currently, we're the only agency that provides those services in those areas. In the future, there may be some other agencies that come in that also provide the service, but historically and for now, Hospicare is your go-to for hospice services. And we are going to talk about advanced care planning, but whenever I have a captive audience, I always like to give a little brief hospice 101, just because I think it's really important for people to learn this information way before they would ever need it. So this is a quote from Dame Cicely Saunders. And Dame Cicely Saunders was a social worker and a nurse in the UK in the 50s and 60s. And she's actually the person who is credited with starting what we know as hospice now here in the United States. And if you Google her, she's got a few famous quotes, and this is one of them. "You matter to the last moment of your life. We will do all we can, not only to help you die peacefully, but to live until you die." And we like that quote a lot because a lot of people, when they think of hospice, they think, oh, that's where you go to die. And she said, well, okay, that might be part of what happens in hospice, but we try to help you live as much as you can until you do die instead of people just waiting to die, if that makes sense. So Cicely Saunders from the UK, thank you very much. She started the hospice movement. So what is hospice? This is a very specialized philosophy of care that's very different from pretty much all other aspects of our healthcare system, because hospice understands that if a person qualifies for hospice and chooses hospice, because hospice is voluntary. We don't ever force somebody onto hospice. So if they qualify, they meet the qualifications for hospice and they choose hospice, we know that that person is going to die at some point, and we don't try to stop that from happening. And that's very different from all other aspects of the healthcare system, where if you have a medical issue going on that's shortening your life or could possibly lead to your death, and you go to the hospital, usually they're trying to keep you alive. They're trying to stop death. And we don't in hospice. We don't try to stop death, but we try to make it as comfortable and dignified and peaceful as possible. And like Dame Cicely Saunders said, we want you to live as much as you can until you die. And here's my proof that I was one of the hospice nurses. That's me with one of the people I cared for on hospice services. This is the illustration of our care team that works together to support the person who's on hospice and their loved ones. So we have the patient and their family and loved ones in the center, and then every oval around that patient is part of our care team. So up at the 12 o'clock position, you'll see it says primary physician. So people's primary care providers, their primary doctor or nurse practitioner or physician's assistant, remains a part of their care team when they're on hospice services. And that's really important to a lot of our patients. Then you'll see at the 1 o'clock position, it says primary nurse. So that's like what I used to do. That's the actual hospice nurse that's coming to visit and is helping to case manage. The next oval down says personal care. Those are our home health aides that are available to help with personal care and hygiene. We have on-call nurses available every night, every weekend, every holiday. So there's always a phone number you can call if you need something medical for your hospice patient. So you don't have to call 911, because usually when you call 911, they'll show up with an ambulance, throw you in the back of the ambulance, and take you to the hospital. And that's where most people don't want to go when they're on hospice. We have a large administrative staff that works in the Ithaca office and sometimes in the Cortland office. Volunteer services down at the 6 o'clock position. This, in my opinion, is a service that's very underutilized and can be a great help for the person on hospice or their loved ones. Our volunteers can provide companionship. They can go grocery shopping. They can do a jigsaw puzzle with a person, play cards. We try to match people up with a volunteer that's going to be a good fit for them. So we try to get to know our patients and what their needs and likes are. So volunteer services, that's a great service we have available. Over at the 7 o'clock position, we have the grief support. So we have a large bereavement team and bereavement support system. Spiritual health is our next oval up. So those are our spiritual care coordinators. Historically, we would have called them chaplains, but we now call them spiritual coordinators, and they're available for the patient and or the loved ones, but we don't force that on anybody. And then we have social workers who are also available for the patient and the loved ones of that patient. And then the next oval up is our medical director. So we actually have our own doctor, Dr. Yander, who is a part of the care team as well. So we have this huge team that comes together to help support a person on hospice and to support their loved ones. Okay, questions about that? Oh. Okay, so now let's talk about
Yes.
advanced care.
I'm
Oh,
sorry.
yes,
I do have a question.
you do
Is
have
the
a question.
is the volunteer services listed on your website?
It is.
Great.
Yep.
Thank you.
Volunteer services are on our website. And also, we have, if people are interested in becoming a volunteer, we have, there's a link on the website for people who want to volunteer. And we have a volunteer coordinator, Wendy, who's been there for 20 plus years. And she's got a very thorough volunteer training and vetting system that she puts people through. So it's not like, okay, you just sign up and we throw you out there and expect you to figure it out. She's really got it down to an art.
Oh, wonderful. Thank you.
Yes, on the website. Good. I'm wondering, oh, maybe view is what I want. I like it. I'm just messing around. I like it when I can see everybody on the side of the screen, even when I'm sharing my. Okay, I have some things happening. Now I have you. I want everybody. Okay, well, I've got you over there.
It didn't
At
work
least I
for
have
you.
someone.
It doesn't give you everybody?
No, and
Let
I
me
think,
try
okay, hold
something
on.
here. See if that helped.
All right. No, I'm missing everyone. That's okay. I'm just going to imagine in my head that you're smiling at me and we'll get through this. Okay, so let's now talk about advanced care planning. So sometimes we have to start by asking ourselves some questions that are maybe uncomfortable to ask. Some people are really fine with asking hard questions of themselves and thinking about their life choices and thinking about their end of life. But for some of us, that's uncomfortable. So here's our first step, and we say, how do you imagine your end of life experience? And that's going to be different for every person based off of what your values are and what your resources are. The next little icon down in the bottom left corner says, who are the family and friends who will be most impacted by your death? In the upper right corner, it says, what medical or life-sustaining care do you want? And then I add on another question, is there any life-sustaining care that you wouldn't want? Because that's also part of your rights as a patient. And then the bottom right icon says, what do you want your legacy to be? And again, that's going to be different for each person. And that's where we like to do this planning, which involves a lot of paperwork. Not a lot, but some, because we like to think about these questions, think about what our answers are, but then we have to write our answers down somewhere. So I mentioned earlier that we'll talk about some medical paperwork and medical decisions, a little bit about legal and financial. Again, I just brief on those because I'm not an expert in that field. The paperwork, leaving a paper trail, how to have these conversations, and then questions and answers, of course. That's always a very valuable time. So for medical decisions that you can make in your advanced care planning, these are three of the big ones, and it sounds like we already discussed all of them actually briefly just in our conversation before we started the actual presentation. So healthcare proxy, and then medical order for life-sustaining treatment, or you'll hear it called a MOLST often. It's called a MOLST here in New York State. In a lot of other states, they call it a POLST, and that simply stands for physician's order for life-sustaining treatment. But we call it a MOLST because a physician can sign it, but also a nurse practitioner or a physician's assistant can sign this order. and then a do not resuscitate order. And I'll explain the difference between the do not resuscitate order and the MOLST order. So starting at the top here, healthcare proxy. A healthcare proxy is a legal document where you choose one or more people to speak on your behalf if there's ever a time when you can't speak for yourself. If you're too sick to speak for yourself or make healthcare decisions for yourself, then we would defer to whoever's listed as your healthcare proxy. It's the person that you choose as your healthcare proxy does not have to be related to you. It does not have to be a spouse. It as long as the person's over the age of 18 and is not somebody who's directly related with your care, meaning it can't be your personal doctor, or if I was your hospice nurse, I would not be able to be your healthcare proxy because that's a conflict of interest. But you can choose pretty much anyone you want to be your healthcare proxy as long as they're over the age of 18 and as long as they agree to it themselves. For most of us, we are going to be choosing a healthcare proxy who's somebody who's close to us, or maybe we've been chosen as somebody's healthcare proxy who we're close to or we love or care about. And it can be difficult sometimes to remember that a healthcare proxy's responsibility is to speak on your behalf. So once you've chosen the person and they've agreed to it, it's really important that not only do you give them the paperwork that proves that they're your healthcare proxy, but also that they're very clear what your decisions or wishes would be if they do ever have to speak on your behalf. And it can be really hard sometimes because, like I mentioned, we usually are the healthcare proxy for somebody we care about. And that can become very emotional sometimes to make those decisions for a person that we care about. And remember, it's our responsibility to speak on their behalf. So those are just some things to think about when you're choosing who's going to be your healthcare proxy. This is what the healthcare proxy paperwork looks like for New York State. It's very simple. It does not have to be notarized and it does not have to go through a lawyer. You just have to have two witnesses who are both over the age of 18 sign that they witnessed that you filled out this paperwork. So what you do is you fill in your contact information and then you name and fill in the contact information of the person you want to be your healthcare proxy. There's also a place for an alternate agent. And I think that was mentioned earlier that you already do have an alternate agent. And then you have a place where two witnesses sign. The witnesses cannot be the person who you're naming as your healthcare proxy, but I mean, it can be a neighbor. I've witnessed for people before. It can be somebody at work, somebody at the library. Does not have to be notarized or a lawyer. So once this is all filled out and two witnesses have signed, that's your healthcare proxy. You're all set. So it's a good idea to have a copy for yourself. You need to provide a copy to the person who you are naming as your healthcare proxy, and then also provide a copy to your doctor or doctors if you have more than one. Something else to keep in mind is that some people will choose, for example, they'll choose that they want all of their children, all of their adult children to be their healthcare proxy. And sometimes that's 3, 4, and 5 people. And I understand theoretically why people do that, but I can say just from experience, that tends to really delay decision making because we have to make sure that we have a meeting with everybody available to discuss what choice they're going to make on behalf of their loved one when we have multiple people listed as healthcare proxy. You can do that, but just something to think about. And that's just me telling you what I've witnessed in my work. Okay, questions about healthcare proxy?
Well, you answered the only one I had.
Okay. All right, so now let's move on to the MOLST form. So that is the medical order for life-sustaining treatment. A lot of people have heard of a DNR order, which means do not resuscitate. And some people will choose that they want to have a DNR order. So that means that they're saying, if my heart stops or I stop breathing, I do not want you to put me on machinery. I do not want you to do chest compressions and start CPR. DNR is part of the MOLST form, but the MOLST form goes into much more detail and much more nuanced choices. So the MOLST form looks like this in black and white, but I'm going to show you what it looks like when you get it from a hospital, it's usually a bright pink color like this. And the only reason it's bright pink is because they want it to be easily identifiable in a person's house. So they made it this bright color on purpose. Black and white copies are fine. They're still considered an actual medical order as long as it's been signed by a doctor or nurse practitioner or physician's assistant. But when you order them and officially get one, it's this bright pink color. And it looks like it's just a little one-page booklet. So the MOLST form goes over multiple questions about what kind of life-sustaining treatment a person may want or does not want. And for a MOLST form to be considered legal, you go over it with your doctor or whoever your primary care provider is. You go over it together and then you sign it and they sign it. So I can talk to you about the MOLST form, but to actually get one and have it be legal, you have to go through a provider. So the very first question on the MOLST form asks about resuscitation. So this is the DNR question. Okay, so the very front page, the first question is, if your heart stops, do you want CPR? And the choices you can make are, yes, I want you to attempt CPR on me, or you can say, no, do not resuscitate me. The next question down, oh, okay, they changed this. Let me make sure I'm telling you the right thing. Yes, the next question asks you, would you want to be intubated? Okay, so the CPR is one thing. That's chest compressions if your heart stops. That's like on TV where they go shock, clear, beep, that kind of thing. Okay, now the next question asks, if you are having a respiratory crisis or you stop breathing, do you want us to put you on a ventilator? And you can say, yes, put me on a ventilator if I need that. You can say, you can put me on a ventilator for a trial period, but if doctors say I'm going to be on it forever and ever, take it away. Or some people say, do not intubate me. And intubate means the tube that goes down, it's the breathing tube that's going down into your throat. So you've got multiple choices you can make there. The next section it asks you about are treatment guidelines. There's 3 choices under treatment guidelines. One says, I want no limitations on medical intervention. That means if I have something, if I'm sick or if I have something, some kind of medical crisis happening, I want you to take me to the hospital and do everything. Hook me up to every machine you have, all the treatment. Yes, try to keep me alive. There's another section that says, well, do limited medical interventions. And that's kind of like, that gives you some room to say, well, maybe I would want some of the treatment, but maybe not all of the treatment. And then there's another guideline that says, just give me comfort measures only. Okay. And that's where people are saying, do not work to try to extend my life. I want you to work to keep me comfortable. There's another section that talks about hospitalizations. So you have a choice here where it says, if you're having something happening to you medically, do you want us to take you to the hospital or do you want to stay out of the hospital? Those are your 2 choices. So one says, send me to the hospital if necessary. And the other one says, do not send me to the hospital unless I have pain or severe symptoms that cannot be controlled. So for a lot of people that I work with on hospice, that's the one that they choose. They say, I really don't want to go to the hospital. If you can keep me out of the hospital, please do so. But for other people who aren't on hospice, they might say, oh, yeah, send me to the hospital if I have a medical crisis. Of course. Now there's a section that talks about fluids and nutrition. So this is one that sometimes people don't think about. This is a section that says, if you are unable to maintain enough calorie intake to keep your body alive, would you want a feeding tube? And some people say, yep, I would want a feeding tube. And some people say, I would never want a feeding tube. Okay. And that's just for each person to choose on based off of what they would want. And so it says, yes, long-term feeding tube if needed. no feeding tube, or in between a trial period of feeding tube. It also asks about intravenous fluids. So if somebody is dehydrated and they need to be rehydrated but can't rehydrate orally, it asks, do you want IV fluids? And people can say yes, and people can say no. The final section, so see, like I mentioned, this gets pretty nuanced. This has some really interesting questions. The final question that people can fill out, or choice people can make, is about antibiotics. Again, a lot of people don't think about this one. So this one is saying, okay, if you had some kind of an infection, would you want antibiotics? And so some people say, yes, please use antibiotics for me, either by mouth or IV antibiotics if I need it. Some people say, nope, don't give me antibiotics. If I get an infection, keep me comfortable and let me die of the infection, or let whatever's going to happen. And then in between, the choice says, determine the use of antibiotics when an infection occurs. So basically that's saying case by case. Let me make up my mind then, or based off of conversations with the doctor. Okay, so lots of questions to think about. Everyone's answers are going to be different. And again, for this MOLST form to be considered an actual medical order, a legal medical order, a doctor has to sign it. Hello. Or a PA or a nurse practitioner. Now, you are allowed to change your mind on these MOLST forms too. So maybe I might say right now in my life, yes, do CPR on me if my heart stops. But maybe I'll get to a point in life where I say, nope, I don't want CPR. So then I would change my MOLST form. You just have to change it with your doctor again. And then you re-sign and you have a new updated MOLST form. When these forms are completed, you definitely want to make sure that your doctor has a copy. And then you need to have a copy on you. And it might even be a good idea to have a copy available for whoever you've listed as your healthcare proxy. Or at least let them know where they can find this if they need it. Questions about the MOLST form? I know it's a lot to take in, but at least you kind of have like an idea going into it. Oh, Barbara, you're muted, but it looks like you had a question.
I think it was the Cancer Resource Center that gave me this thing that I stick on the side of my refrigerator.
Mm-hmm.
And, you know, so that if it's like an ambulance comes to get you or something, you know, right now I have my living will there and my proxy form and so on, but that would be a good place to keep the MOLST form probably too, right?
It would, and that's usually where we do direct people if they have a MOLST form and they're feeling like they're at a point in their life where they want to make sure if an ambulance gets called, this is available. We do tell people to put it on their refrigerator because that's a consistent place in most people's homes, and that's where EMS have been trained to look for this kind of paperwork. So that's, yep, the fridge is the main place in the home.
Okay.
Kimmy, I wanted to chime in for a moment and say, if you're not sharing your screen right now, maybe hit pause or stop, because right now there's a kind of a double screen thing happening.
Well, let me go back over here. How's that looking?
Now we're back to the MOLST form.
Okay.
Is that where you want to be?
That's where I want to be now, yes.
Okay.
But yeah, holler at me if I come back out and I forget to pause. So just pause the recording.
The sharing?
Oh, okay. I think I understand what you're saying. Okay, let's see how we do. So that's the MOLST form. And then moving on, the DNR order, or do not resuscitate order, this is like a much shorter MOLST version. That MOLST form had way more questions on it than you're going to see on a DNR. Typically, a DNR order, which looks like this, see, much more simple. It means do not resuscitate, do not do CPR on me. But it doesn't talk about antibiotics and IV fluids and treatment guidelines.
I have another question.
Okay.
Are you going to talk about living wills and how the living will relates to the DNR?
I will briefly discuss living will. Yes, a little bit. But let's see
Because
what I tell you
I
versus
have a
what your
living
questions
will
are.
and I don't have a DNR, so well, I'm not sure whether that serves the same purpose or not.
They kind of do. It's like a Venn diagram. Like there's some overlap. But that's also where your healthcare proxy would be pulled in. If you were unable to speak for yourself about things that you would want done or not done to you, then your healthcare proxy would be the person who we'd ask for those decisions.
Yeah, I wrote something on my healthcare proxy saying that they should follow my wishes in my living will.
Okay. So as long as they know where they can find your living will or have a copy of it, then that should
Yeah.
be covered. Yeah. Good question.
Okay.
Okay, so now we're going to talk about briefly some of the legal advanced care planning that people can do. So there is a durable power of attorney. Durable power of attorney gives a person the ability to make financial decisions when you are not able to. So this would be if you are incapacitated for some reason, you're too ill or too sick to make these decisions. And that is while you're still alive, if I'm understanding correctly.
Question.
Yes.
Is this the same terminology as a power of attorney, or is it different?
Oh, okay. Yes. I'm coming over. Did I stop sharing my screen?
Yes.
I did. Okay. So if I'm understanding correctly, I had to look it up because I get confused with power of attorney compared to durable power of attorney. And if I'm understanding correctly, durable power of attorney has more flexibility. That's a person who can speak on your behalf financially when you are incapacitated or unable to speak for yourself. Whereas a power of attorney, it can only make financial decisions while you are still of sound mind. So the durable power of attorney, the durability is that they can make decisions on your behalf and act financially on your behalf, even when you are not of sound mind.
This is very interesting because I've never heard the term durable, only just the term power of attorney.
Yeah. And a lot of people say power of attorney, but we are meaning durable power of attorney. It's just like such a mouthful. But that's as far as my Google search, and I've looked it up a few times, tells me that's the nuanced difference between power of attorney and durable power of attorney.
One other question, the DNR, and what was the other form? Because I joined late. Was it called MOST? MOST?
MOLST. Yes, the
ST?
MOLST
Are
form.
these available at the Cancer Resource Center or online or through a doctor's office?
The MOLST form you get from your doctor or the hospital, and that's because you have to go over it with your doctor and they have to sign it for it to be considered a legal order.
Okay.
So that's through your doctor or whoever your primary care provider is. And then what was your other question?
The DNR, is that's
thing.
same
Yep.
thing from doctor?
Yeah.
Okay.
Yeah. DNR, because
Thank
the
you.
DNR is also considered a medical order. And so any
Yeah.
medical order has to be signed by a
Doctor.
physician or primary care. Good
Thank you.
questions. Okay, let me not forget to share my screen again. And we'll go back to there. How are we looking?
Great.
Okay. So durable power of attorney, somebody who can make financial decisions on your behalf, even if you're too sick or incapacitated to do so. And then a will, not a living will, but a will indicates what you want done with your assets after your death. A living trust provides instructions about your assets and your estate and where you want those finances and resources to go after your death. A living will, which is not on here, but a living will, as far as I understand, and I know this gets really muddled because we're using all the same terminology. A living will is not necessarily a legal document, but it is a guideline for whoever has been appointed as your healthcare proxy or your durable power of attorney. It's guidelines for them to know what decisions you would want them to make. But as far as I understand, a living will isn't technically like a legal document. Whereas these, the durable power of attorney, will, living trust, are legal documents. Some people choose that they want to be an organ donor. And some people in New York State, especially in our area, even choose that they want to be what's called an anatomical gift. An anatomical gift is essentially donating your body to science. And we have a program through Upstate Medical Center in Syracuse that people can be an anatomical gift. If somebody wants to be an anatomical gift or an organ donor, there is paperwork to fill out. And then you get a card that indicates that you've made that decision. Or sometimes the your driver's license will indicate that you are an organ donor. I don't know that driver's license can indicate that you are an anatomical gift, though, meaning you want your entire body to be donated to Upstate Medical Center. What I can tell you is that if somebody has chosen that they want to be an organ donor or an anatomical gift, even if that person has filled out all of the paperwork and made it known, on paper, in writing, what their wishes are, if we have somebody who would be a candidate to be an organ donor, we would still approach the next of kin and say, are you okay with moving forward with an organ donation of your loved one? And the next of kin can say yes or no. Okay, they can only say, let me make sure I clarify. They can only say yes if you have indicated that you wanted to be an organ donor or an anatomical gift. So they can say, yes, I agree with that. Let them be an organ donor. But even if you say you want to be an organ donor or an anatomical gift, your family can still say, no, we don't want to do that. The opposite is not true, though. You cannot say, no, I don't want to be an organ donation. And then your family can go in and say, yeah, go ahead and let them be an organ donor. That's not true. But they can say no on your behalf. Does that make sense?
Yeah.
Yeah.
After I designated that I wanted to be an organ donor on my driver's license, I got a letter in the mail saying to discuss it with my family.
Uh-huh.
So, they just, they wanted, I don't know, they just.
Yeah, and that's most likely why, is because if you found yourself in a situation where you were an organ donor candidate, then the medical team reaches out to whoever your representatives are or your loved ones. Not all of them, but your designated person, to say, it looks like Barbara had indicated that she wanted to be an organ donor. Are you comfortable with us moving forward with that? And then your representative could say yes or no. And I can tell you from working in a hospital, if we approach a family and we say, oh, it looks like Barbara was an organ donor. Are you comfortable moving forward? If the family says no, we leave it at that. We don't pressure. We don't try to talk them into it. It's left alone at that point. So just information for you to have from me, being on that side of things. I just thought it was interesting.
Yeah.
Okay, we're getting through it. Let's see where we're at. Yes, share. I will figure out the screen sharing by the end of this. Okay. Okay, so now we've talked about our medical documents. We've talked a little bit yes.
I'm going to chime in. There's a little pop-up on the bottom that's just blocking the words on the bottom. I think if you hit hide on it, there you go. Great.
Did we get it? Okay, thank you. We've talked about our medical documents. We've talked a little bit of what I know about legal documents. And I did mention that once you've chosen who your healthcare proxy is going to be, make sure that they know they're your healthcare proxy and that they've agreed to it, that they have the paperwork that proves they're your healthcare proxy, and that they also know what your wishes are and or where to find the paperwork that they might need, where you have your wishes written down. You can also include some important information like bank account numbers, insurance policies, social security card, passports, mortgage, deed, vehicles, things like that. Those don't all have to go to your healthcare proxy, but we do recommend that you kind of gather those in a central location, whether it's in a binder at your house or like a box under your bed or somewhere where people can find this information, because I can tell you from one, being a nurse and seeing it, but two, also being the oldest daughter of a family and always being the one who has to handle when somebody has a medical crisis in our family, that when there's a significant medical event that happens or a death, that all of this information is needed pretty quickly. And it can be quite stressful to be digging around trying to find this paperwork while your loved one is very sick, or maybe you're grieving because your loved one has just died. So we recommend that you gather this information, have it somewhere that's easily locatable, and that whoever it is that you would want to have this information knows where to find it. So they would know, oh, there's a box under her bed that has all this in it, or a file cabinet in the office, or a binder somewhere. We do have a whole presentation that we do about making a binder with all of this information in it. And I think it's going to happen next month or the following month. But this is one of our in-services that we also provide, making this just in case binder. Something that's really interesting that I've learned about safe deposit boxes is that the second that bank or wherever the safe deposit box is, which I think is usually at a bank, is informed that you have died, they lock this. And it is very tedious. Is somebody agreeing with me? Is that what I just heard?
Yes. Yes, I've been an executive for people. Yes.
Yeah, it's a very arduous task to unlock somebody's safety deposit box after they've died. And so if there's important information in there, it will very much delay the whole process because it takes so long. It's an undertaking. So they can be good for some things, but just know that.
You can go ahead and hit stop share, pause share, maybe. Or you're going back? Okay.
I'm going back. I went too fast. Okay, and then this little booklet, the 5 Wishes booklet that looks like a little blue rectangle there. This is an actual booklet that we have, and I'm going to bring some up to the Cancer Resource Center this week. You can also get it at 5wishes.com or .org. It's a very, I'm going to make sure I tell you the right thing. This is a really popular booklet that's available across the whole nation. And it is essentially a little booklet that guides you through your first living will, or some people's first living will. So it has all kinds of different questions that it asks you, and prompts, and places for you to just write directly in the booklet with a pen to fill in some of your wishes. And if you don't know the answer to all of the questions it asks, you can just skip over them. But the ones that you do know, you can fill out. So this is just kind of a nice little tool that we use. Okay, that we can use for people to guide them through questions. And we recommend that people take this and also take a copy for somebody that they know. It's a really nice little tool. It's kind of simple, and you just take a pen and fill it right in the booklet there. So these will be available in 2 days at the Cancer Resource Center. But again, you can also get them from us at Hospicare, and you can get them. I'm really looking for the agingwithdignity.org. But if you Google 5 Wishes booklet, this will come up. Okay, we're almost there. So the next step for a lot of people is they've done the work of thinking about what their wishes are. Oh, I got blacked out now. I'm really struggling with this screen share today. Okay. So that should not be a little sad face right there. I don't know why it's not letting me. I'm going to try over. The next step for most people is how to have the conversations with your loved ones. Well, my computer's having a hard time today. That's okay. So for some people, having these conversations with their loved ones is quite simple. They are capable of having difficult conversations, and that's fine. But for a lot of people, starting the conversation about, well, hey, I was looking at if I want CPR or not, and I'm thinking about what do I want to happen after I die. Sometimes that can be really uncomfortable, especially for the people who care about us. And so we have some suggestions for how to bring up that conversation. My favorite way is to simply say, oh, I went to this webinar last night and now I'm working on this. I want to show it to you. And that's a way to open up that conversation for people. Another way to open up that conversation is to say, well, I know what my wishes are, but I want to make sure that you know what my wishes are, so that if you have to make a decision for me, it's not as stressful. You can also ask other people. You can say, I know what my wishes are, but I don't know what your wishes are. Why don't you tell me yours? And then you start that conversation as well. And ultimately, what I can say is one of the colleagues that I used to work with here at Hospicare, who worked in the work of hospice, said that when her mom was starting to fill this paperwork out, her mom said, oh, I want to show you, I'm filling out this paperwork. And my colleague who works in hospice said, oh my gosh, Mom, I don't want to talk. That's morbid. I can't even think about that. So even though she worked in this work, when it became time that it was somebody she cared about, it was much more emotional for her. And she said it took her mom's just gentle, loving prompting a few times before she was able to soften and actually have that conversation with her mom. So even those of us who are the professionals, it can be really difficult for us as well sometimes to have those conversations. But I do really like using a tool as the opener to the conversation. So just saying, oh, I'm working on this booklet. Do you want one for you too? And then you can start there. I know that was a lot. What questions do you have? It sounds like you've got quite a bit already that you've started on.
Kimmy, you were talking about the paper trail, and you said something about a binder. I mean, this is something I've done all the legal documents and stuff, but I was thinking that I needed to make this list of like bank accounts and insurance policies and keep it all in one place, and I haven't completely finished that. So, how did you say, what kind of a tool do you have to help with that?
So we actually have a presentation like this, but it's all about making this binder and putting together your important paperwork. And it just goes much more into detail about different information that we suggest people keep in their binder.
Yeah.
And I say binder, but it doesn't have to be a binder. That's just what most people do. But you can throw it into a bag, you can throw it into a safe or a file cabinet, or those, those bank boxes that have the little handles. Yeah, something like that is perfectly fine. What's important is that whoever it is that would need access to that paperwork and information, that they know what they're looking for and where to look for it. So if I say, oh, there's a box on the top of my closet and it's labeled, important information upon my death, or whatever it is, so that they know where to find it.
Right.
And we have a checklist. It's just a Word document. It's not very pretty or exciting, but it's a checklist that takes you through all of the different things that we suggest. I'd be happy to email that to you.
Yeah, that would be helpful.
If you feel okay. And do you, Bert, you have Barbara's email?
Yeah.
Okay, great.
Do you want to send it to me or?
I'll send it to you and then you can just have it.
Okay.
To send out to whoever you can, and you can forward to Barbara, but that way you just have it too to send out.
Thanks, Kimmy.
Anything else? Did I answer your questions about the MOLST form? I know earlier you had mentioned that you were interested in learning more about that.
Well, I'm going to see my doctor at the cancer center tomorrow, so the nurse practitioner. So I plan to ask her about it. That's one reason I came
Okay.
tonight, so as I could, you know, yeah, I wanted to ask her if she thought that I should do one or, you know, anyway. So
What
I'm-
her
I
advice
think
is.
I'm-
Okay, excellent.
I think I'm interested in doing one, and they should have them available at the cancer center, I'm sure.
Yes. Yep. They'll have them there, and you can always. This is a great idea then that you came to kind of get at least have an idea of what you're going to be talking about. And you can always change these too. So you might have choices that you make this time, and then later down the road you might change those choices, and that's fine. They actually have space available for us to change our choice and then re-sign with the
Oh.
doctor.
Okay, great,
Yeah.
good.
Well, thank you very much for coming this evening and for your great questions. Bert, thank you for your help and guidance through my screen sharing and all those things.
You're
Do you have
welcome.
any questions or anything else that I can help with tonight, Bert?
It was great. I do not. You answered my questions as we moved
Okay.
along, and it was just one observation. I was surprised to hear that you can sign to be a donor, like an organ donor, or what was the full
Anatomical gift.
anatomical, and after you pass, someone in your family can reverse that.
Right. Yeah, they can say no. And once they say no, we don't push. We just say, okay. Yeah.
Sure.
Yeah.
I
And
found that
that usually doesn't happen, but it can. Yeah.
a bit peculiar, but just a little piece of information. But no, I thought this was fantastic. Nice.
Great. Great.
Thank you
Well,
so
thank you
much.
so much
Yeah,
for having me.
I guess it isn't, I mean, I don't need to share this with the two of you maybe, but when I went to get my durable power of attorney done, I called a couple of lawyers' offices and they said to do my will and my power of attorney would be $1,500 or something.
Oh my. Uh-huh.
So I Googled, could I do my own will? And it said, yes, you can do your own will in New York State. So I did my own will. Someone gave me the legal, they gave me a form that like what do you call it? A template kind of thing. So I did it according to that. And I took two witnesses over to the city, the courthouse, not the court. Yeah, the courthouse. Ithaca Town Hall, I guess it was. And anyhow, they notarized it for me. The two witnesses signed at the same time, and it was really, really simple. And my lawyer, I had a lawyer in Pennsylvania who's also licensed in New York State, and she did my durable power of attorney for $100.
Oh, that's
So
much better.
that
That's a
was
much more
better.
economical. Yeah.
Yes. So, I mean, I think it's a little daunting for people if they call,
It
if
is.
they consult a lawyer and they give you some really, very high cost. So that's how I handled it. I can't recommend that to everybody, but whatever.
Yeah, a lot of people do. I think it's freewill.org or freewill.com where
Mm,
you can do your own as long as it's a simple will, which I don't know what makes a will simple or not. Like, but yes, that you can do your own, and I think that's much better than having to
yeah.
who has all that disposable income. Not a lot of people to pay for a lawyer.
Yeah.
Well done. Good research.
Okay.
All right. Well, it was very nice to
Thanks so
meet you.
much.
Thank you for coming. And
Yes, thank
on
you.
Thursday, Bert, I'll bring those 5 wishes booklets. And in the meantime, I will email Bert the checklist for the binder, and you can forward that to Barbara.
Will do.
Excellent. Okay.
Okay.
Thursdays when I
Thanks.
make sure. Yep.
Thanks so much, Kimmy. This was really helpful. It made me
I'm
realize
glad.
the gaps of the things that I haven't done yet. So.
Don't let it be overwhelming. Just do one thing at a time. That's what I tell people.
Right. Well,
Sometimes you
that's
get
what
these
I've been doing.
checklists
And
and they can get overwhelming.
yeah.
Yeah.
Great
Okay.
to see you
Very
both.
good. Well, you take care.
Thank
Stay
you.
warm.
Mhm.
All right. Bye-bye.
Bye.